Hello friends, and this is Kashmira and welcome to my channel. Now today I'm going to talk about post-delivery depression. Now birth of your baby can trigger a lot of emotions in you, from joy and excitement to fear and anxiety. But it may result into something which you might not expect, and that is a depression. Many moms experience post-delivery baby blues, which are very common, and they may start from like first 3 days after delivery to 1 or 2 weeks. Now, what are baby blues? Baby blues are basically, a little bit of mood swings, disturbed sleep, irritability, and all of that. But post-delivery depression, it is something which is more severe from of a baby blue, and it may last from about 2 to 3 weeks from that till 6 months of your time period. Post-delivery depression, it is not a character flaw or a weakness. It is just the complication of your pregnancy. Now, all the new moms out there, how you gonna identify whether you suffer from post-delivery depression? There's a small screening test which I'm gonna link it down below, and you can definitely go to that link and check. It's a kind of a questionnaire. You can just fill. You can just say yes or no, and it just can actually relate whether you have a depression or no. It is very important. I know many moms out there, they are very reluctant, or they will not accept that they do suffer from this. But from a personal experience, I'm going to tell you guys that it is very common, and 15 to 20% of the women suffer from it. And definitely I also went through it. Not a kind of a post delivery depression, but definitely a kind of a baby blues. So, irrespective of that screening test, so how you're gonna identify whether you suffer from post-delivery depression is, if you feel, very sad, if you feel, that you're gonna cry, like with seriously no reason out there, if you feel that you cannot bond with your baby well, or if you feel that, you are not a good mom, if you feel tired, if you feel that you're not worthy enough, a lot of confusion, a lot of fear, if all that of all those emotions if you have in you, then definitely there is a clear indication that do you have some kind of a post delivery depression. If you have severe anxiety, panic attacks, or you may feel that you're going to harm yourself or your baby, then please schedule an appointment to the doctor. You can take help of your own gynecologist, or you can actually consult a good psychologist, or even you can go for your the baby's pediatrician. Those all specialities will help you down and will guide you so how to overcome the depression. Now, what are the causes of your post-delivery depression? There are two type of causes of your post-delivery depression. So first can be a physical changes. So physical changes basically your decrease in your hormones of your like estrogen and progesterone. Those are the pregnancy hormones. They decrease drastically in your body after delivery, and because of that, there are series of your emotions in you. So it may cause a depression as well. And there's another thing which is happens in your body after delivery is the hormones which are produced by your thyroid gland, they also drop drastically. So that is why you may feel sluggish, you feel tired, and you may feel depressed. Now, the second cause of post-delivery depression are your emotional issues. Now, emotional issues. Why emotional issues? Okay, so it's a childbirth is a very people feel happy. People are excited that there is a new member in your family, but when you are sleep deprived and plus when you're overwhelmed, okay, two opposite kind of emotions are together, then you cannot handle minor problems in your day-to-day life. So you feel difficulty, you get anxious, you feel irritable, and all of that. So if it is a first pregnancy of yours, then you definitely have a doubt that whether I can be a good mom or no. So you always, have a confusion, or you always question yourself that whether I can be a good mom or no. So that can also, is a triggering factor for the emotional disturbances in you, and which may also lead in depression. Now another thing which is very common in the girls nowadays is, before pregnancy I used to look very attractive. I used to I used to weigh only 40 kgs, I used to weigh only 45 kgs, but right now I'm like 10 kgs overweight, 15 kgs overweight. So somewhere or the other you feel insecure about yourself. You feel that this is not me. I was never this much. I never ever in my life I used to weigh this much. So definitely that can also trigger that depression factor in some of the girls. And it is so important nowadays, people, they always concentrate that how you look and how you are, how you dress up. So there are a lot of changes in the society. So for a new mom to adjust in that, it is very difficult, and it may trigger a depression factor in some people. Now, what is the treatment for this post-delivery depression? Now, there are conservative line of treatments, there are home remedies also available, and there are medications which are also available for this. So, conservative line of treatment can be applicable to those women out there which have simple baby blues. So, as I said earlier, so baby blues, they just start after first or 3 days after your delivery, and they may last up to 2 weeks. So during that time is most of the girls are hospitalized at that time. So there are a lot of emotional disturbances which occurs, and one thing for sure you need to do and you need to take care is rest as much as you can, because rest is very important. Okay, that will help you to cut down your anxiety, that will help you to cut down your fear. You need to accept help from your family. People in your family, they are ready to help you being a new mom. There's a new baby, there's a new member in your family. So definitely, you need to be free. You seriously need to be free to ask help, like please help me down, please, for few hours, please take care of my baby so that I can sleep well, so that I can feed him or her well. So another kind of a treatment which is available and which is applicable for the moderate to severe kind of depression is it are the medications. So medications will be prescribed by your doctor, either by your gynecologist or for the further super specialization. So please go through it if you require, but most of the time you can manage it by yourself. If the symptoms go out of hand, then definitely you need to see your doctor immediately and go through the medications. So do whatever the course which is prescribed and motivate yourself, and you can definitely overcome this. There is nothing in the world you cannot overcome. Just remember that you are a mom, you are an individual, you have your identity, and you are best, because it is not defined, nowhere in any of the books it is written that mom should be like this, she should do this, she should do that. No, Just be yourself, and I'm sure all the good moms out there will definitely, whatever their daughter, whatever their son, they will definitely, make them, give them a good values, give them a good upbringing. I'm very sure about it. But just don't forget that you are yourself, and just be yourself. And another thing is, which is very important, is avoid isolation. Now what happens is, when you're a new mom, you have a lot of confusion, and you have you have a lot of things in your head. So you don't do it on purpose, but definitely, something happens, like, how can I leave my baby, and how can I, go out with my family members, or how can I mix up again, how can I have that routine again. But just avoid isolation. Take your baby along with you. It is all fine. Meet your friends, talk to your friends, meet your family members, talk to them, and I'm sure they are gonna come and see your baby. So talk to them, don't feel depressed. One more thing, which is, especially for the new dads out there, please support your spouse. Because you should support your spouse. Why? Because not only because she's given birth to your baby, but definitely the whatever the emotional stress, whatever the physical stress she is going through, even if it is a milder form, even if it is a moderate form, or even if it is a severe form, please support her. Now I should, it my husband supported me a lot through this, and definitely, he motivated me, always, and he still gives me confidence, and he still feels that, you are the individual, we have a family, we have a son, but you shouldn't forget yourself. So if all new moms out there, and if all new dads out there, if they like my video, if you guys like my video, please give me a thumbs up and subscribe to my channel. That's it. Bye.